From CGTN headquarters in Beijing, this is The Hub with Wang Guan.
Hello and welcome to The Hub on CGTN. I'm Wang Guan in Beijing. It is a race against time as Myanmar reels from a 7.9 magnitude earthquake on March the 28th, the deadliest in a century. Villages flattened, roads severed, and hospitals overwhelmed. And the death toll keeps rising and millions have been displaced. Survivors now also have to battle 35 degrees Celsius heat, landslides, and cholera threats. How's the current situation on the ground and what humanitarian needs are badly needed at this point? I'm joined at this hour by Ms. Noriko Takagi, UNHCR representative in Myanmar. Ms. Nakagi, welcome to The Hub on CGTN. Thank you so much for doing this. I understand this is a very delicate and difficult situation for you in Myanmar. First of all, thank you very much for joining us, and thanks to you and your team and all the hard work.
No, thank you for this opportunity.
Ma'am, let me start by asking you about the latest situation on the ground in Myanmar. What is the latest after this massive 7.9 earthquake on the Richter scale, especially when it comes to rescue and relief work? What are the biggest challenges?
The destruction that I'm sure many viewers have seen on the photos and the videos, the destruction, especially in the second largest city in Mandalay, is quite significant, as well as in the political capital of Naypyidaw. We do have a team on the ground. We had a team before this earthquake, already assisting the internally displaced people due to the conflict, but also our staff and their family have been affected like millions of people. This area is the area that had been also engulfed by the conflict, and we had already about 1.6 million internally displaced people in the area. But now with this earthquake, we do believe that an estimated number of 3.8 million people have been living in the severely affected area of the earthquake. 5 days on, we understand that at least the Mandalay airport, some commercial flights have resumed. Communication is slowly coming back, but still very patchy. But as far as I hear from my team on the ground, the electricity and also the clean and drinking water is still a problem. The people are sleeping outside because their houses were destroyed or unsafe to return to, including my staff and my family. They are also sleeping either in the office or outside because they're also still feeling the aftershock that's still continuing.
I'm truly sorry about all this, the plight of the locals and also your team that are trying to salvage the situation, helping the locals in need. Tell us a bit more, if you don't mind, about the secondary disasters, or potentially so, because of the earthquake-induced power outages, water outages, the blocked roads and communications, especially when it comes to power outages and the lack of clean drinking water. How much of a challenge, a concern are those conditions to you people?
Yes, it is very concerning, and I think the extent and impact of this earthquake will be felt more and more by the people affected in days to come. Of course, the rescue efforts are still ongoing, including the team that came from China. But as the days go by, there's importance of having a clean water, including drinking water, and also the shelter, something over their heads to protect themselves from the sun, strong sun, and also at night. It is very important. It's the hottest time of the year in the central part of Myanmar at the moment. So the temperature goes up to about 40 degrees. And in 1 month's time, the rainy season will be starting in Myanmar. So it's very, very critical that we will get this life-saving, critical humanitarian support to these people who've been affected.
So it is a limited time offer in the race against time for you and your helping staff.
That's right. So the most critical needs, urgent needs that we are receiving from the communities that are affected, they're basically the shelter, clean water, food, of course, and medical and hygiene items to sort of get through this initial period after the earthquake. For UNHCR, we have mobilized some critical relief items that's consisting of things like plastic sheeting, mosquito nets, kitchen sets and blankets, solar-powered lamps and soaps in Mandalay and also in Sagaing as well as in Naypyidaw. But we are shipping more of these goods from our central warehouse overseas.
Are you concerned about potential outbreaks of diseases like diarrhea and cholera, considering the very hot and humid conditions and also a lack of drinking water in large parts of the country?
Yes, very much so. This is not only for the drinking water, but water that you need for washing yourself and also washing your kitchen items, so on and so forth. These spread of communicable disease, the risk of it will spread. Also in Myanmar, since the last monsoon season last year, there have been the reports of acute water diarrhea and cholera being reported throughout the country. So we are very much concerned, especially our sister UN agency, WHO. They are keeping a very, very close eye on it, and they are already starting to assist the population in the hard-hit area with various medical kits.
We know that the situation in Myanmar has been complicated. A surge in conflict in Myanmar since October 2023 gave rise to the internally displaced, which are adding to the work of UNHCR, a team that you're leading in Myanmar. How are the earthquake and earthquake-induced challenges causing, further complicating the situation?
As I said before, this country already before the earthquake already had a 3 million conflict-induced internally displaced people, and out of which the 40%, about 1.6 million of people, are living in areas that are hit by the earthquake. This earthquake is basically, for us, it's a humanitarian crisis on the top of the already quite acute humanitarian crisis. The funding has been challenging. The last year for 2024, the entire humanitarian response that includes UNHCR's needs, we had about 1 billion, a little short of $1 billion of humanitarian needs, but only 34% has been funded. And this year, already on the 4th month of the year, for the entire needs of $1.1 billion, we only have even less than 5% of those needs covered. And this is before the earthquake. So you can imagine, the challenge that we're having in trying to address those additional sort of crises that occurred and it fell upon the people of Myanmar.
And then we understand that Myanmar is, having this challenge of having one hospital bed berth per 1,000 people. According to, the United Nations, that is not very sufficient, judging from the figure itself. And how much of a challenge has the earthquake put on the already strained public health resources?
Yeah, that's right. And you've probably seen in the video footage that many of the big hospitals, major hospitals, both governments, but also the private ones, either they were collapsed completely or severely damaged, so that all the health workers were having to treat their patients outside. And I heard from my colleagues in Naypyidaw, where he saw that they were treating, and also inward patients are actually staying out in the parking lots. So the needs are very huge. And these two, especially in Mandalay, where the population is congested, the second largest city in Myanmar, the access to health services, the immediate health services is quite a concern.
Right, and also some economists predict that after this 7.9 magnitude earthquake, Myanmar's economy could be severely damaged, as much as 70% of its GDP, inflicting loss and damage due to this earthquake. Just help us understand what you see on the ground when it comes to the amount of work for reconstruction and economic losses potentially happening to this country.
Yes, I mean, I'm not an economist nor a civil engineer, but it is quite clear from the image that you can see the lot of social and commercial infrastructure. So it includes, hospitals and schools, but also markets, shopping centers, factories, farmlands. There's a significant damage. And this is on the top of frequent natural disaster that this country suffers. Last year, the Typhoon Yogi and caused this massive floods in a vast majority of the country, not necessarily on the area where it was hit by the earthquake, but in other parts of the country, which already significantly worsened the economic situation of Myanmar. So, but this earthquake that hit hardest at one of the commercial centers of the country, I can imagine the work that's required for the reconstruction and also the rehabilitation of those economic activities.
Ms. Takagi, let me ask you about yourself. How are you yourself doing? I guess this is one of those life-changing events happening to you since you led UNHCR's work in Myanmar. What has been happening?
Thank you for asking. Well, in Yangon, we did feel the shake, but it wasn't very bad, and also there was no immediate or no major damage to any of those buildings. So the business is as usual in Yangon, at least. So I am able to sleep in a comfortable bed and have a clean water. I think it's our team and also the millions of people out there in the central and northwestern Myanmar that are really suffering. Our team is resilient, like many other Myanmar people, and they are continuing to assist the people who are affected. And it's also really heartwarming to see the Myanmar people also helping each other, even though they themselves are very badly impacted by this earthquake.
And then finally, what else do you think the international community or the viewers watching our program should know about the UNHCR's work in Myanmar and also the plight of the people coping with this earthquake and this aftermath in Myanmar?
As I said, this is a huge humanitarian crisis on the top of the very acute crisis that this country was facing before. So the more and more stronger support from the international community will be required in order to assist not only the people who have been affected by this earthquake, but also 3.5 million people who have been affected by the conflict. So I do really hope that this earthquake, it's a very unfortunate event, but also put the light on the situation of Myanmar to a wider international community.
How would you assess the role of China since the earthquake began?
If I remember correctly, China was one of the first country to provide assistance to Myanmar. I think it's very commendable, and I think we do hope that this kind of collaboration will continue. I think we, and also many countries, including China, I think we're just trying to reach the people in need, the people who are affected, no matter where they are, despite the conflict that's happening, despite the contestation of the territory, so on and so forth. I think this is the time that we have to come together and address the acute humanitarian need of the people of Myanmar.
At this time, we have to come together. Ms. Noriko Takagi, UNHCR representative in Myanmar, thank you so much for your time.
Thank you very much.